Well, let's now take a look at the wider spread and some of the latest developments there. I'm joined by Dr. Mark Parrish, the Regional Medical Director for International SOS. And, of course, we were hearing about the first case being reported in Sub-Saharan Africa. Which countries are you watching particularly closely? Are you most concerned about in terms of healthcare systems not being robust enough to handle an outbreak?
The World Health Organization actually reviewed countries' abilities to handle pandemic outbreaks and reported on that only last year. And their comment was that many countries still lack many of the areas that they need to have in place to deal with these outbreaks, which we know there will be, and there's one now, there'll be one in the future. The ones that we are particularly concerned about and that we are advising our clients with are those, let's say, the less developed countries. You look at Iran, the coronavirus from Iran has spread to countries like Afghanistan. There's a country with a healthcare system that really is struggling at the best of times. If you add on the coronavirus, then that will cause real problems for these countries.
Such as?
It will just overwhelm their healthcare system. We know that approximately 5% of all of us that get coronavirus will require a reasonably large amount of hospital care, potentially helping us with our breathing and our blood pressure with antibiotics, and you may need to be in a high dependency or an intensive care unit. In a country like the UK or in Europe, where we have many of those, we are concerned about that as well, and we have many preparations for that. If you have a large number of people, then 5% of them suddenly becomes quite large. In other countries where their healthcare system is struggling at the best of times, Afghanistan, elsewhere, that's a real problem. And that will lead, I think, to unnecessary mortality and morbidity.
And I suppose in many of these countries it might be difficult to establish how widespread the outbreak actually is because the testing capacity might not necessarily be there.
Yes, a multiplicity of reasons for not really understanding how far it's spread. If we look, Iran is a good example of this. If we accept that 2% of all cases with coronavirus will end in death, and if you look at Iran reporting maybe 50 to 100 deaths so far, the number of cases is much less than you would expect. So that would indicate that there are many cases currently unknown about in the community. Part of that is educating the healthcare system, but it's also educating the public, the general public. If we look, certainly in Europe, healthcare organisations have done a very good job of that. In other parts of the world, it's been harder. The messaging is harder to get out.
I mean, on that point, tell me, what have you observed in Iran and the Middle East?
We have, in some countries, we find that cultural overlays of these things makes it a little bit harder to be possibly as transparent as we've seen other countries, and for individuals who have the disease to be open about it and to tell their healthcare system. We could compare that with China, where there has been the most phenomenal reaction by the Chinese public health authorities. Again, WHO reviewed this recently, and they said that the Chinese response has probably prevented at least 100,000, if not more, cases in China itself. And that's why we've seen cases in China flattening off, whereas in other parts of the world, they're still continuing to go up. So the trick, what we need to do is to use those traditional methods of containment to keep this disease under control, as we've seen in Italy and in South Korea. That's how you contain the spread of coronavirus.
Thank you very much, Dr. Mark Parrish, Regional Director for International SOS. Appreciate your thoughts.
Thanks.